I'd like to tell you about my very own mother. She died at the age of 101, and she played bridge on her second to last day. And she often said to me, Bina, you have to be lucky in life and lucky in death. And she was one of the lucky ones. But not everyone is that lucky. She used to tell me that she wasn't afraid of dying. It was a natural part of life. And I shouldn't be afraid either. And when I look back, I realize what an amazing gift she gave me in telling me that. And I want to relay that to my own children. It's time we all started to talk more about death and dying. I want to share with you the objective of the presentation I have here this afternoon on behalf of Dying with Dignity Canada. So we're going to be covering a lot of information. If you take away one thing and one thing only, I hope you remember this. If you have knowledge of the options available to you, that will give you more choice in your planning and decision-making, and ultimately more control of your end-of-life scenario. So knowledge of your options gives you choices, and choices gives you control. An important message. What are we going to be covering in today's presentation? Well, I'm going to tell you about Dying with Dignity Canada, our organization. You see the acronym up there. And what is medical assistance in dying? MAID, MAID. How did it become legal in Canada? And what's new? Many of you have been reading a lot about it recently in the papers because of new legislation, so I'm going to explain that. What's on the horizon? And then we'll be taking your questions. My associate, Marianne Sikuti, is a subject matter expert in medical assistance in dying, and she is our GTA chairperson for our chapter, newly formed. So we have an interesting presentation here for you today. First of all, our organization. What is Dying with Dignity Canada? First and foremost, I want to let you know we're a human rights charity. We have over 2,500 members across Canada. We started in Ontario and grew to a national organization. And in 2020, we celebrated our 40th anniversary, advocating for the right to choose how and when we die as Canadians. What do? We defend human rights by advocating for assisted dying rules that respect the Canadian Constitution and the Canadian Charter of Rights and Freedoms. We receive no government funding. We're fully funded by private citizens who are looking for a way to die with dignity. In a recent Ipsos Reid poll, 85% of Canadians supported medical assistance in dying for those who meet eligibility criteria. So we're going to talk about those important eligibility criteria coming up. What's our focus? Our focus is fourfold: eligibility, access, support, and education. We're committed to protecting end-of-life rights, improving the quality of dying, and helping Canadians avoid unwanted suffering. In terms of eligibility, we ensure that assisted dying legislation complies with the Canadian Constitution and the Canadian Charter of Rights and Freedoms. In terms of access, we work to ensure Canadians can access MAID in compliance with the Constitution and the Charter. We support people, their family, their caregivers, and doctors, nurse practitioners, as they explore end-of-life options, all of end-of-life options, including MAID. And we initiate educational programs just like this one here today to inform people, to inform caregivers, the public, healthcare providers on end-of-life options, including MAID and medical assistance in dying, MAID and advanced care planning. How do we do this? Well, We support and we intervene in court challenges related to Bill C-14. Bill C-14 is the legislation that allows for MAID. We work to ensure that doctors who object to MAID, when they're asked about it, must refer the patient to others who will give them the information they're seeking. We provide information, emotional, and personal support to anyone who's interested in MAID. So let's define MAID specifically. I'll give you a minute to read these definitions. So MAID, medical assistance in dying, is the administration of a substance by a doctor or nurse practitioner at the person's request that causes death, or the prescription or providing substance to a person, again at their own request, for self-administration to cause their death. Let's go back in history and look at how MAID became legal in Canada. These three women paved the way, and they're very important to dying with dignity. You may recognize the top younger woman who received a lot of press back in 1993, for those of you who are old enough to remember that. This is Sue Rodriguez. In 1993, Sue Rodriguez was 42 years old, and she suffered from ALS, Lou Gehrig's disease, and she took her case to the Supreme Court of Canada. And she asked the Supreme Court, if I cannot give consent to my own death, whose body is this? Who owns my life? The Supreme Court upheld the criminal code in a provision 5-4 decision. In other words, it was still a crime to help someone access their own death. That was 1993. In 1994, Sue Rodriguez took her own life with the help of an anonymous physician. She ingested a combination of morphine and secobarbital. Fast forward 20 years, and we meet two additional women who are very important in the fight for the right to die with dignity in Canada. On the lower left is Gloria Taylor. She also suffered, like Sue Rodriguez, from ALS. And Kay Carter on the right, she suffered from degenerative spinal stenosis. And regrettably, both these women didn't live to see the fruits of their labor. Kay Carter went to Switzerland to access medical assistance in dying in 2010. That was the only country that allowed non-citizens to access MAID. And Gloria Taylor died of a severe infection in 2012. But let's look at the Carter decision, Carter versus Canada. In February of 2015, the Supreme Court of Canada's decision in this case was released, and the Supreme Court at this point determined unanimously that the prohibition on physician-assisted dying infringes the right to life, liberty, and security of the person. So before it was a 5-4 decision, tough one, and now in 2015, it was unanimous. Since June 2016, over 13,000 Canadians have accessed an assisted death to relieve them from intolerable pain and suffering. So let's look at who's eligible for MAID in Canada. An important point, eligibility. First of all, you have to be eligible for publicly funded health services, which in Ontario, of course, is OHIP. You have to be deemed to be mentally competent. In other words, you have the capability to make your own healthcare decisions. So it's important to note that the decision to seek MAID is not undertaken lightly in Canada. You have to be seen to have a grievous and irremediable medical condition. And that's a bit of a mouthful. I'm going to talk more about that in a moment. The people who are assessing you for eligibility have to determine that you are making this request voluntarily, that no one is pressuring you to make this request. And you must be aware of all the medical options available to you so that you're informed about every option and that ultimately you give your consent to medical assistance in dying. These are the eligibility requirements. So let's go back and look at grievous and irremediable medical condition, because that needs to be determined and explored. Well, you have to have a serious illness, disease, or disability, and you need to be in an advanced state of decline that cannot be reversed. You have to experience unbearable physical or mental suffering from this illness, disease, or disability, and be in a state of decline that cannot be relieved under any conditions that you find acceptable to you. And your natural death has to be reasonably foreseeable. I put that in red because it requires more discussion, and it was the focus of the recent legislation and the articles you may have been reading about in recent months. Reasonably foreseeable death. Let me go back a minute and just introduce two important people who challenged this reasonably foreseeable death criteria. In 2019, Jean Truchon, who suffered from cerebral palsy, and Nicole Gladue, who suffered from post-polio syndrome, were two Quebecers. And they challenged Bill C-14 regarding the eligibility criteria for a reasonably foreseeable death in order to access MAID. So these two Quebecers took their case to the Supreme Court to challenge that specific criteria. And the Quebec court ruled that the need for a reasonably foreseeable death in order to be eligible for MAID was unconstitutional. And the federal government accepted that decision. As a result, they drafted Bill C-7, which was a further amendment to the Canadian Criminal Code and broadened the eligibility criteria for MAID. So just last month, March 2021, Bill C-7 received royal assent and became law in Canada. Bill C-7 now allows persons whose death is not reasonably foreseeable to request and seek approval for MAID. But that leaves us with a two-track system, one for people whose death is reasonably foreseeable and one for people whose death is not reasonably foreseeable. So this is a very ambiguous legal term. It was difficult for doctors and nurse practitioners to actually interpret this term, and it resulted in the medical community being unable to really understand the intent behind this term and to apply it for those people who are seeking MAID. What were the issues? Well, it excluded people who were chronically ill and had unbelievable pain and suffering from their illness. And it created inconsistencies among doctors and nurse practitioners who were assessing people for MAID and determining if their death was reasonably foreseeable. It created inconsistencies in these assessments. So that's one of the things that Bill C-7 changed. Those whose death is not reasonably foreseeable now have a pathway to seek MAID. So I mentioned these two tracks, and we created this chart that may bring it into better focus. This table on the left column are people whose death is reasonably foreseeable and people whose death on the right is not reasonably foreseeable, to understand the law a little bit better. The decision to seek MAID begins with a written request, And for those people whose death is reasonably foreseeable, the person must have been told that their condition is irremediable, and they must have been told of every means available to them to relieve suffering, including palliative care. For people whose death is not reasonably foreseeable, they must have been told about their condition and every means to relieve suffering. They must have been told about counseling services, mental health and disability support services, community services, and palliative care. And they must have been offered consultations with professionals who provide these services. And they and their doctors must all agree that alternative means to relieve suffering, all alternative means, have been considered. So these are important safeguards that are built into the legislation. In terms of who assesses these individuals, two individuals assess them. For those whose death is reasonably foreseeable, any two medical practitioners who have been approved to make those assessments can conduct the assessments. For those whose death is not reasonably foreseeable, one of those medical practitioners must have expertise in that person's condition. So if the condition is cerebral palsy, one of those doctors or nurse practitioners must be an expert in cerebral palsy. And if they're not, then a third assessor comes in to make the assessment. Again, important safeguards. The waiting period for people whose death is reasonably foreseeable can be short or none. For people whose death is not reasonably foreseeable, they must have a 90-day reflection period from the first assessment until MAID is performed. Again, an important safeguard. In terms of final consent, if your death is reasonably foreseeable, you may waive final consent. But if your death is not reasonably foreseeable, final consent must be given. Let's look at how the MAID process rolls out. So it all begins with an initial inquiry when a person asks their medical provider, their doctor or nurse practitioner, what are the options available to me at this stage? And that medical provider must give them all the options available to them, including palliative care, including any treatments available to them, and they must also include medical assistance in dying. But what happens if that doctor doesn't support medical assistance in dying? Well, then they're obliged by law to refer that individual to someone who will give them the information that they're seeking. So that's an important point here in Ontario, the obligation for a doctor who doesn't support MAID to refer you to someone who does. The next step is a written request. In Ontario, the written request is called Clinician Aid A form. There are other forms from some healthcare institutions, but that's the main one. And no one can ever request MAID other than the individual seeking it themselves. They must fill out the written request. This written request will establish your eligibility to proceed with the process, the criteria that we talked about. It will establish that you're capable of making this request. That means that you understand your medical condition and you've been informed of all treatment options, including palliative care. The signing of your written request must be witnessed by one independent person, and that independent person has to meet specific criteria, another important safeguard. What happens if you can't sign that request, if you can't write, if you can't have no use of your hands? Well, then a third authorized person may be able to sign on your behalf, but that person also has to meet specific criteria. I want to point out that all along this MAID process that I'm going to be rolling out for you, you can change your mind at any time and you can stop the whole thing right up until the very end. So just because you fill out a request for MAID doesn't mean you ever have to go through with it. Next come the assessments that I talked about just a minute ago. Your doctor or nurse practitioner, an independent doctor, or should I say, a nurse practitioner, will come in to assess an individual for MAID. And they will determine, after a long interview and going through all the medical files, whether the individual meets the eligibility criteria that I just spoke about. They'll make a determination, and after they're finished, a second independent assessor, doctor or nurse practitioner, comes in and does the same thing all over again, interviews you, goes through all the medical files, and determines whether you meet eligibility criteria. Only when both assessors agree can you move forward with the MAID procedure. For those whose death is not reasonably foreseeable, as I mentioned, there's a 90-day reflection period after the assessments have been completed before the MAID procedure can be carried out. I also want to point out that if you're not happy with the assessment, you can have a third, a fourth, you can have as many assessments as you want. Once the procedure is scheduled, the MAID provider issues a prescription and picks up the drugs that are needed on the day MAID is to be provided or self-administered. Prior to the administration of the drug, the person receiving MAID is asked to give final consent for the procedure. This can be a verbal assent, or if the person can't speak, it could be a nonverbal gesture. Or the person can change their mind right at the last minute and say, I've thought about it, I don't want to go through with it, and that's okay too. If consent is given, the drugs are administered for a quiet, peaceful death, which is not at all painful, takes about 10 minutes, and death is pronounced, and the death certificate is issued. For those who are interested in more personal stories, you can go to our website, Dying with Dignity Canada, and go to the blog and read some very heartfelt stories of people who so appreciated the opportunity to access medical assistance in dying and the option of dying with dignity. The stories on the blog are very heartfelt. I want to introduce you to Audrey Parker. In 2018, Audrey Parker lived in Halifax. She was suffering from stage 4 breast cancer. It had metastasized to her brain, and she applied and got approval for medical assistance in dying. Audrey really wanted one more Christmas with her family, but she was afraid that if she waited for Christmas, she wouldn't have the mental capacity to give consent because she knew that the cancer had gone to her brain and she was losing her mental capacity. She realized that there was a flaw in the legislation, and others did too. So she chose to die earlier than she needed to. She chose to take MAID in November and missed that last opportunity for Christmas with her family. But Bill C-7, the recent amendment to the law, contains Audrey's amendment in the form of a waiver of final consent. So if your death is reasonably foreseeable, you can sign a waiver, and that would have allowed Audrey to schedule her death after Christmas, and she wouldn't have had to give final consent. What's next? Well, there's going to be a comprehensive review of MAID legislation over the next 2 years. And this will be by a joint committee of Parliament and the Senate. And the review will address some very important issues and we'll develop some important safeguards. What are the issues? Well, mental illness as the sole condition. The government will hear from experts and develop safeguards and protocols for anyone who falls into this category as their sole condition. It will also consider advance requests. So for anyone with onset of dementia, they will be able, hopefully, to have an advance request, and they'll be able to determine, come the time when I don't recognize anyone, or I can't feed myself, or to look after myself, I want medical assistance in dying. It'll look at protection of Canadians with disabilities, and we'll look at the issue of mature minors, defined by law as a child of any age who's capable of providing consent if they have the maturity, intelligence, and capacity to understand the nature and purpose and the consequences of such a decision. So there's a lot of work to be done over the next 2 years, and this will be the comprehensive review that Dying with Dignity will be involved in, and Parliament and Senate. So let me summarize some key points as I come to the end of this presentation. Some takeaways from this short bit of information. MAID is legal, and it's your right as a Canadian. It's important to know all your options in making your end-of-life choice and having control of your end-of-life scenario. Only you can request MAID. Nobody can request it on your behalf. And once you begin the process, the request, you can stop it at any time. The safeguards are built in for you. Every story has a beginning, a middle, and an end. And the more we participate in writing the end of our own story, the more satisfied we are with the arc of our life. MAID allows for planning, being in the place you want and having the people around you and the things that you want around you at the end of your life. It's very reassuring and comforting to both the person, their family, and friends. MAID has been described by both those present and the medical practitioners as being very comforting and peaceful. At Dying with Dignity Canada, we believe everyone has a right to choose a good death. Thank you very much, and we'll look forward to your questions now. Mary Ann Sikuti will be answering.
I have one, if I may.
Of course.
Get us kicked off. I'm wondering if Dying with Dignity Canada offers supports to caregivers who might be struggling with their loved one's decision to pursue MAID, or if there's any resources that you know of that you could suggest if someone is maybe having a hard time understanding or coming to terms with someone's decision to pursue MAID.
Yes, we do have a support group that I would classify them more as navigators. They don't necessarily provide psychological support in that, but very much are an excellent resource to point you in the right direction for what you need.
I would just take this moment to remind everyone that they can unmute if they'd like to ask a question, or they can ask it in the chat and I can relay the question if they aren't able to unmute or don't feel comfortable.
Oh, I was just going to ask a little bit, and you probably covered it because I really enjoyed your presentation, and I'm so impressed with how far we've come, although it's taken a long time and a lot of suffering and such. But regarding someone once removed or etc., like for a friend or someone you've known for some time who is just in really bad place. And again, you probably went over it in your presentation, but what are the steps there for again, I guess there's some intermediaries, legal and medical, that ensure there's proper separation where someone is struggling with the decision themselves and is quite helpless, etc.
Absolutely, because the most important factor in making your request is that you're doing it of your own free will and there's no coercion. And as you saw in Venus steps, the first step is to approach your healthcare provider. If you're considering MAID, they are bound to give you all of the information they have about what alternatives you do have. From there, if you want to pursue this further, you complete your request for MAID. The assessors spend a lot of time with the person who is exploring this, insofar as learning about their medical health history, their mental health state, where they are, why they want to pursue this. And very much part of the assessment is that they are not being coerced into this decision. So it's very much a one-on-one interview, two-way interview, the assessor getting the information they need from the person giving them that information. It's not anything that's done quickly without a lot of thought on both parties' parts. And as Bina said in her presentation, as you go through the process, just because you've made a request doesn't mean you have to go through with it. Just because you've received your 2 assessments and approval doesn't mean you have to go through with it. Even though you've set a date for your procedure, doesn't mean you have to go through with it. And day of procedure, the last question the person is going to be asked is, do you want to go through with this? And if the answer is no, or there's a physical indication that they don't want to proceed with it, it all stops.
Thank you very much. I took a little course back in CGIP days a long time ago, but it was principally around Elizabeth Kubler-Ross, which I believe at the time was one of the sort of frontier people on this journey to give people this right. I think she was American, but it doesn't matter. I'm not sure what the laws are like down there or elsewhere, but I know they're a little bit better in some of the other countries that you mentioned that are a little bit more progressive. But it's so those people are so courageous to get us to where we're at, because it's so necessary. Like, it's so sensible. It's so humane. Thank you very much for the presentation. I really enjoyed it.
Thank you, Ed. I
Absolutely.
have, oh, sorry.
Oh, no.
I
Go
have
ahead.
a question in the chat here. It's a question from Michelle. It's a great question. Are individuals with mental illness, such as clinical depression, would they be eligible for MAID?
At this point in time, with the Royal Assent of Bill C7, the answer is no. But part of that bill also put in provisions that over the next year, an expert panel is to convene and do a deep dive into this and what would be required to allow people with mental health issues who want to pursue MAID be eligible for MAID. So the first step in this process is the expert panel basically setting the criteria for it. The same way, similar to the criteria they've set for people whose death is not reasonably foreseeable. And I'm not saying the criteria are going to be the same, but they have to set the criteria. So that's going to take 1 year. So as of February 2022, the government is expecting a report to be submitted on what these criteria will be. There is then another year that is going to pass, which allows the provinces and in the healthcare care providers, how are they going to implement this? And what regulations are going to be needed in the provinces to allow this? But as the legislation stands now, as of February 2023, people with mental illness should be able to access MAID. Does that answer your question?
Yes, thank you so much.
Are there other questions there?
I just want to make sure that, as I understand it, I've had two friends who have used MAID in the past. It's been a couple of years now, but they had to, like, here's the timing. There's an exact amount of time between when they requested it, when they met with the doctor, then the second doctor. Then they have to meet with the doctors again in a certain time period. And then the doctors set the date. And both of these friends would really have rather have the date later on than it was, but here's the time frame it all had to be in. So with C7, what you're saying is they could have set it for like a month later than the date it actually ended up being, if that was what they had preferred.
Absolutely. And also C7 has brought in the Audrey's amendment. So it's a waiver of final consent. So the situation that your friends were in was they could not waive their final consent. They had to either be mentally competent when they were finally asked,
Exactly.
you want us to proceed, they had to be able to either nod or say yes.
That's right. That's right.
So what happened with your friends was very similar to what happened with Audrey Parker, right? She chose her procedure earlier. Now, with the waiver of final consent, your friends or Audrey Parker could have said, no, I don't, this is when I want my procedure. And it's not in a month, it's going to be in 3 months. But I'm going to sign this waiver of final consent with my provider. And if I lose capacity before the date that's set, this gives my provider the authorization to go ahead with the procedure and not face any legal consequences. So that's a big step forward for people. And I think will take a great weight off a lot of people because nobody really wants to go before their time.
Yeah. Well, that was a real thing. And that was something that was the hardest part, like with their children, with both of them, with their children being around, the fact that they weren't hurting yet as much as, they thought they would be, but they were afraid being in palliative care too long and having too many drugs, they wouldn't be able to sign. And so
exactly.
That's good.
This waiver of final consent has taken that burden from a lot of people.
Yeah. Thank you very much for the presentation.
You're welcome.
I have a similar question in the chat here from Angela. Is there talk of any provision for people with a diagnosis of dementia to request MAID at a future date when their chosen guardian determines they would want it?
Well, the first thing I'm going to say is right now with the way the legislation stands, people with dementia are not precluded from seeking MAID. It is, do they meet the requirements or not, or the eligibility requirements for MAID. In response to the second part of that question, with the review of Bill C-14 that's coming forth, very much on the table is the request to include advance requests within the revision to the legislation. And what I mean by advance request is that someone, not just any people with dementia or Alzheimer's or anything, could stipulate in their advanced care plan that if certain criteria were met, at that time they would like to receive MAID. So that would give the their substitute decisions makers authority to request MAID on their behalf, providing the criteria set out by the person were met. So as Bina again said in her presentation, oh, when I don't recognize my children anymore, I would like MAID, or when I can't feed or toilet myself anymore, or, you know, again, it would be a very personal set of criteria that would have to be established. And for those who are following the news, Senator Pamela Wallin was a great advocate of having this included in the last piece of legislation. Unfortunately, it was rejected by the House. We know it's going to be on the table for sure with the review that's coming up, because there is a lot of support out there in the community that this gets addressed. Does that answer your question? Great. So one of the things that's interesting about the new legislation as well is that they've removed the 10-day waiting period for those with a reasonably foreseeable death, which was a bit of a barrier. I shouldn't say a bit of, was a barrier, could be a barrier to some. As with palliative care, I know that people are advised to start it earlier than later, and the earlier the better. I would have to agree that if someone is considering MAID, that they also start the process earlier than later. Again, because you can always stop it. You can always say no. By removing that 90 or the 10-day wait period, that's made things a little bit easier. But again, explore your options.
This is really great. And I think this is a topic that a lot of our volunteers are hearing a lot about and maybe have concerns about, or even just not a lot of knowledge about. So I really hope that this has been helpful for anyone who might be supporting someone who is concerned about it, thinking about it. If you know people, I hope this has helped address some of those questions. Of course, if you have more, we still have lots of time. Feel free to put it in the chat or jump in. But I just want to remind everyone that I just put an evaluation survey in the chat that I will also send by email, and that you can reach out to me if you have questions, and perhaps I can also direct you back to Dying with Dignity if there are questions that come up after. Lots of great feedback too in the chat. So there's a question here from Janet, I believe. Yes, from Janet. With the process as is currently in place, approximately how long does it take from beginning to end?
That's a good question, but a difficult question, because a lot will be dependent on scheduling the assessors and providers. In my experience, the physicians and the nurse practitioners that are assessors and providers are very devoted and extremely responsive. Things can be done in a matter of days, if nothing has been done prior to that. And each case as well is a little bit different, and I think that's why I suggest that if someone is considering this, that they start the process earlier rather than later. And I sometimes get the question too, that does choosing palliative care preclude someone from receiving MAID or vice versa? And there's some interesting statistics around that, because they found that people who opt for MAID most often have received palliative care. And of the more than 82% of people who invoke MAID have received palliative care, yet only about 15 to 30% of Canadians actually access palliative care as a whole. So this is a bit of a question, you know, why is this so? And is it just because the group that receive MAID are better informed about their options? Or they just have those end of life supports in place for them that allows for this?
I have another question in the chat. Is MAID allowed in the home as well as in an institution or healthcare setting?
If your provider's in agreement, you can have MAID anywhere. The stories we've heard from the providers, they've done it in gardens, they've done it in hammocks, they've done it in a person sitting in their favorite chair, with pets. It's you are the author of your exit, if I can say that, and whatever makes you happy and whatever is important to you to have around you, it can be the way you want it. The music, the people, the food. You know, one gentleman, beer and pizza with his buds. It's how you want to do it, and I think that can be, if I can say, the beauty of it.
Well, I don't have any more questions in the chat, so maybe I'll just do a final call for questions. I can stay
I
for a
think
little.
we have one more here.
Perfect.
One just popped out. It says, do you not think the reason is that MAID is one of the items nurse managers ask when visiting cancer patients? I'm not, Suzanne, if you could just explain
that's
your question a little bit more to me, I'd appreciate it.
both of the people friends of mine who accessed MAID were diagnosed with cancer. It was a fast moving cancer. By the time it was diagnosed, they had, you know, all of a sudden nurses and everything coming into their homes. The nurse managers who were over the nurses coming into their homes told them about MAID.
Mm-hmm.
The one woman had never heard of it before, didn't understand what it was. That was one of the choices that were offered to them. They were going to be using palliative care within, 6 weeks. It was assumed. That was one of the choices that were told to them. And it was started right away. like
Mhm.
start the wheels in motion.
Right. Well, the
Whereas-
College of,
I'm just
Sorry.
thinking, whereas other people, you know, when you say that they, you know, more aware of it, when they're in palliative care, that could be one of the reasons why, because other people, like if you go in and see your doctor, it's probably not anywhere near the top of his list.
no, you're right on that account, but the College of Physicians and Surgeons of Ontario have provided advice to their members that they are to include MAID as part of an option. And if for reasons, either personal, religious, whatever, they do not support MAID as an option in end-of-life care, they're to provide what they call an effective referral. And by effective referral, that means I don't want to talk to you about this, but here is a doctor who will talk to you about this. And it's not going to take me a month and a half or 2 months to give you this referral. I'm going to do this referral now. Now, in cases where you may have a healthcare provider who is not supportive of this and you want to pursue it, the Canadian Association of MAID Assessors and Providers has an excellent website and support for both providers and the public and healthcare caregivers such as yourself. And they can also help you access physicians or nurse practitioners in your area who are assessors and providers. So the resources are out there, and Suzanne, I understand the frustration that many people face in trying to put their fingers on those resources. And Dying with Dignity Canada, and I'm more than happy to help you put your fingers on those resources that you may need. And any other resources you may need in making your end of life decision. This isn't the only choice. We're all about the choice that you want for your end of life.
Thank you.
Well, I just want to take this opportunity. It's about 1 o'clock to say a big thank you to Bina and Mary Ann. This was really, really informative. It was really timely. And I really appreciated the chance to have a chance to ask and hear other people's questions and answers. So like I said, it's 1 o'clock. We're at the sort of official end of our session today. I can stay around for a couple minutes in case there's questions or concerns. But again, I just want to say a big thank you to Bina and Mary Ann for coming here and providing this really informative and engaging discussion.
You're welcome.
You're more than welcome.
Been our pleasure.
Thank you.
Thank you so much.
And thank you so much for everyone attending today.
That was really well done, Kathleen. Thank you for coordinating.
Yeah.
Hi, Marianne. Oh, I guess we've lost Bina.
We
Anyways,
lost Bina.
yeah, I just wanted to thank you. I'm the Director of Programs and Services, so Kathleen is on my team. And when she brought this opportunity to my attention, I thought, yeah, what a great opportunity. So